What I'll be speaking about is the VA's personal health record system. I'll try to kind of cover this in three parts. One is what is the My Healthy Vet program, that's the personal health record system. I'll give a quick overview. Then talk about some efforts going on in the VA to improve it through research and evaluation. And then give you an example, or a few examples of ongoing research projects related to this personal health record system. This quote is a bit pessimistic, but I think it captures where we are. This was 2 years ago. I think we're still about here, but many of the people in this room are working on these issues. So let me just read this briefly. In the current healthcare delivery system, most patients are still not able to access their provider when they need to, don't know how to manage their own health, often do not understand what the provider tells them during a visit, and do not have access to their own health information when they need it. HIT has not been well leveraged to address consumers' needs and allow them to best manage their health. I think as a result of groups like this and conferences, we are changing this, but this is really the status quo right now in healthcare. Very briefly, the Veterans Health Administration serves about a quarter of U.S. veterans, about 5 million. 90 to 95% male. The numbers of females are rising, and the VA is becoming a bit more user-friendly for women. It's the largest integrated healthcare system in the U.S. In general, veterans who use VHA services tend to be lower income, lower education, in general less well off than veterans who are using other forms of care. And a study by Louis Kazis a few years ago found that veterans who use VHA compared to kind of the general population getting care in other health plans report themselves as substantially worse off health-wise. So the My Healthy Vet program, an electronic personal health record system. It's what we call a tethered system. That is, it's very closely linked to the VA's own electronic medical record system. If you leave the VA and decide to get care elsewhere, it doesn't really go with you. It was launched in about 2005. The growth has been more slow in terms of the numbers of veterans using it compared to a number of other high-profile systems like Group Health and Kaiser. Absolute numbers are pretty big because we've started with a population of 5 million veterans. The goal is to help veterans engage more in their care, provide them information, and make care delivery more efficient and maybe more convenient. So of the 5 million or so veterans, about 1 million, a little bit over, have done what's called registration. And that's a very easy online registration system, but it only gives you about 10% of the functionality. You really have to do something that they call IPA, or in-person authentication. You bring in your ID, you watch a 10-minute video, sign a couple of forms. One of the forms is basically releasing information to yourself, ironically. And then you can get this higher level of service, which really is the full functionality. Refilling prescriptions has been the biggest draw. 19 million prescriptions have been filled electronically since 2005. A new feature that was described by President Obama in one of his recent talks is the blue button. It allows you to download your medical information. It's somewhat limited because of the functions available, but it does allow you to get a text file or a PDF. A few features I'll just run over very quickly. Currently, there's your medication list. You can refill your medications, allergies and immunizations, look at what appointments you have upcoming. There is secure messaging, being able to send email-type messages to your healthcare team. Very soon, if you look at the bottom, sorry about that, you'll see that chemistry and hematology are coming up, and something called delegation, which I'll talk about, which is basically an official way to share your record with a family member, a friend who you trust. There are also a number of features that allow patients to input their own information. An important thing about this type of information is it does not cross the barrier into the electronic medical record. It's really just for the patient's own use, their own ability to organize their information, unless they decide to then print out some of that information and bring it to their doctor. So they might enter their supplements, their over-the-counter medications. They might track their food and weight. There are also a number of self-assessment tools for depression, PTSD. I think I'll move over this fairly quickly, but what I wanted to show in this slide is the VA has been doing an online survey of users of this personal health record, and they've been trying to add features based on what the veterans say they want. So as you can see, the features that are in black or bolded have now been added. Viewing upcoming appointments was pretty new. It was very highly requested. Scheduling and changing appointments. Actually, I think this is wrong. I don't think you actually can schedule yet, but that's high on people's priorities. We took the medication refill off of this because it's been addressed. This is just a very brief view of what it looks like for a veteran who wants to do a refill. They can see their medication list here. And if it's in blue, they are able to click on it and do a refill, or they can look over here. And this is found to be very easy to learn, and it's very popular. So what's interesting about My Healthy Vet? There are a lot of numbers of veterans using it. There are linkages to quite a few VA databases, not least of which is the electronic medical record, pharmacy data. They're doing satisfaction surveys to understand what's working and what isn't, and what veterans like and would like to see more of. And importantly, and that's where I'll spend the rest of my time, is that there's a dedicated VA research unit that is evaluating and trying to do implementation science and improve the personal health record and how it's used in the VA. This research unit is called the eHealth Quality Enhancement Research Initiative, or the eHealth Query. It's based at the Bedford VA, but is working with at least 8 other VAs around the US, including West Haven. Its goals include to work with program offices, sorry about that. And this is a very important aspect in that it's not supposed to be an ivory tower kind of research, but we work very closely with the My Healthy Vet program office, and our goals have to be closely aligned with what their goals are. And secondly is there's a very large emphasis on implementation science. That is, when there are things that look good, seem to be working, how do you get people to actually use them in practice? Very briefly, the goals also include increasing access and meaningful use, and enhancing veterans' ability to self-manage their health conditions. A few illustrative projects that I will skim over. Just showing you this list, I'd like to point out that we're trying to look at really all levels. So we're thinking about whether clinicians and clinical staff are thinking about this personal health record. Do they even know that it exists? We're working with veterans who have various health conditions, including HIV and hepatitis C. We're looking at whether caregivers, family members and friends can be involved in that personal health record and using that information. And we're working with diverse groups and groups that are often hard to reach, homeless groups as an example. So very briefly, the clinic-based project is looking at an existing reminder that is in the electronic medical record system that indicates to a clinician whether a patient who is in front of them has registered for the personal health record system. It exists, but it's rarely used. It doesn't seem to be helping in terms of getting more veterans to sign up. We've designed a project to see whether some kind of wraparound to that reminder could help. Maybe it's a peer veteran who could talk to the patient after their visit and say, oh, do you want me to show you how to sign up for this system? Another would be making these videos and the sign-up process a little more efficient. A project that I'm leading is one in which we're taking groups of veterans, one group HIV positive, another group hepatitis C positive. These are people who have had very little use of computers in the past. They were selected because of their lack of use, and trying to understand whether a brief training for in-person sessions at computers will help them become more comfortable and interested in using the system. And here was one person who, after a couple of sessions, I thought this was quite interesting. She's now kind of learned how to use the system, and she says, I just get nervous going into my Healthy Vet. But that's me, you know, going, okay, is it going to let me in? And sometimes I make mistakes and I have to re-log in. And then there's times when it will tell me that I logged in too many times and I won't be able to do it for 24 hours. I'm not a sociologist or a psychologist, but there's a lot going on in here where this anxiety about using the system, this was a 50-year-old, this anthropomorphic view of the computer, it's almost like a real person, and then this fear of making mistakes, and if you make mistakes you're going to be punished and by not being able to use it. So there are a lot of users like this in the VA. We have a lot from the Vietnam era who may not have used computers very much. Another person, though, had this kind of revelation that there's a lot out there on the condition of interest. And they had no idea that Berkeley and Harvard and Princeton and Mayo Clinic had websites on their condition. And this person just said, this is really cool. Just very briefly, we are finding that at least on self-efficacy and there was increases over this training program and in just absolute number of types of different internet uses. There were increases, a little bit less so in our HIV group, but these are very small numbers. Sometimes people say that internet and e-health is a team sport, and that's what this informal caregiver project is about. The realization that for many people there's somebody at home who's helping them with their health condition. That person may be better at computers and know how to use them. Here was an example of a friend who was putting up his buddy, a veteran, who had hepatitis C, providing room and shelter and some paid wage. But as a friend, there was no information he could get from the VA about this person. And he realized that information was going to be very important. He said, people that are involved in day-to-day care of this person need more information, even if they have to go in and sit down with the doctor or the nurse, because the treatment results for the patient will be better in the long term. And yet he was quite frustrated in trying to get information. I told the woman at the VA that I wanted to know what the situation was, or I was going to throw the guy out of my house, because I didn't want to expose my family to anything that could compromise their health. And I was told politely, you have no right for this information. The personal health record has a function that they hope to roll out in the next year or so called delegation, which would allow the patient to give permission to this friend, for example, to look at his record and see, oh, okay, this person's in treatment for hepatitis C. Oh, and they have these 3 appointments coming up. Oh, and by the way, they ran out of their medication 2 months ago, and maybe they should get it refilled. So in this study, we are planning to do dyadic interviews, find a veteran with hepatitis C who has an informal caregiver, family member or a friend, and do some in-depth qualitative interviews to understand their relationship, whether that caregiver is helping them. In some instances, we expect we'll find that the caregiver could actually be preventing them from getting on board with their treatment. If there's issues with alcohol and substance use, the caregiver may actually be a problem. Okay, I guess I've got 1 minute left. I'm pretty close here. Our goal is to then develop a resource manual for these caregivers, and then ideally to develop some interventions around this delegation function, where we would make sure that the caregiver has access to the veteran's personal health record. And then this project is just in development. We'd like to work with homeless veterans and cell phone use, and use cell phones with texts or phone calls, reminding them about appointments, or some kind of adherence depending on the condition we choose, basically to increase the continuity of care for veterans. And there's Providence VA has been doing a lot of work in this area, and we hope to link up with them. So just to wrap up, personal health records have an advantage of timely 24-hour available information. We believe there's potential for improving a lot of processes and potential outcomes. In the VA especially, there's a long way to go in getting greater adoption. We're basically at 5% of veterans who use the VA being signed up to use all the functions. And then there's an issue of tailoring and making sure that the 50-year-old is comfortable using the system and finds it appropriate, as well as the 25-year-old who's coming back from Iraq. And just kind of the glib summary of that is, don't assume that everybody's 30 years old, because they aren't.